Hello everyone, my name is Meghana Pagadala and I'm an MD PhD student at UCSD, co-mentored by Drs. Hannah Carter and Jill Meserov. And today I will be presenting my poster titled PRState, Incorporating Genetic Ancestry and Prostate Cancer Risk Scores for African American Men. Prostate cancer is the most common non-skin malignancy in men and disproportionately affects African American men, who have a 1.6 and 2.4 fold increased risk of prostate cancer diagnosis and age-matched mortality compared to men with European ancestry. Prostate cancer is also one of the most heritable cancers, with twin studies attributing 57% of prostate cancer risk to genetic factors. As a result, genetic risk scores are of clinical value for prostate cancer risk prediction. However, most genetic risk scores are based on European GWAS studies and have limited applicability for other populations such as African American men. So for this study, we wanted to better understand the role of genetics in prostate cancer in African American men, and we wanted to develop a polygenic risk score for African American men for prostate cancer. To do this, we first started off by identifying an African ancestry discovery cohort in the ELLIPSE Consortium. The ELLIPSE Consortium is composed of 91,644 men with or without prostate cancer and with genetic information. We used FrogKB, which is a tool with an ancestry informative SNP panel of 55 SNPs that predicts the likelihood of African and European ancestry in individuals. We used different thresholds to maximize the size of our discovery cohorts and to minimize admixture, and resulted in an African discovery cohort of 4,533 men and European discovery cohort of 5,567 men, as shown in Figure 1. To identify African ancestry specific prostate cancer risk variants, we conducted an association analysis with prostate cancer status in African American men in the ELLIPSE Consortium, as shown in Figure 2, and identified 10 significant associations on chromosome 3, 8, and 11. We then constructed a polygenic risk score with these 10 variants that we called PRState and evaluated its performance in Figure 3A. We were able to achieve an AUC of 0.65 when we combined our PRState score with age and family history, which are other important factors in determining prostate cancer risk. In comparison, we constructed a polygenic risk score based on risk variants identified through our European discovery cohort, and were only able to achieve an AUC of 0.59, which was significantly lower than performance of the PRState score. This suggests that using ancestry-matched polygenic risk score models boosts performance in predicting prostate cancer compared to using ancestry-mismatched models. Next, since there have been numerous trans-ancestry prostate cancer genetic studies that have been conducted, we wanted to evaluate if a trans-ancestry polygenic risk score model would be able to recover some of the performance in predicting prostate cancer risk. And indeed, we were able to achieve an AUC of 0.66 when we developed a trans-ancestry polygenic risk score model. Next, we wanted to evaluate how PRState performed in comparison to existing genetic risk scores. Recently, Conti et al. Published a comprehensive prostate cancer study, and we built a genetic risk score based on this paper. Of note, a number of the variants that we identified were also identified by the Conti et al. Study, and we excluded these variants when building the Conti et al. Genetic risk score. We then evaluated the performance of the PRState score, the Conti et al. PRS, and combined them with age and family history. And what we found in Figure 4 is that the combination of the Conti et al. And our PRState score led to better performance in predicting prostate cancer risk in African American men compared to using the Conti et al. Score by itself. Next, we validated our PRState score in the Million Veteran Program, which is a cohort of over 500,000 men with genetic information and also prostate cancer information. In figures 5A, B, and C, we found that the combination of the Conti et al. Score and the PRState score led to better prediction of any prostate cancer and metastatic prostate cancer in African American men compared to using either the Conti et al. Score or the PRState score by itself. We note that the combination of the PRState score and the Conti et al. Score did not lead to significantly better performance in predicting death from prostate cancer or fatal prostate cancer compared to the Conti et al. Score by itself. Then in figures 5D, E, and F, we found that the PRState score better predicted prostate cancer, metastatic prostate cancer, and fatal prostate cancer in African American men compared to European men. So to conclude, through our study, we identified African ancestry-specific risk variants and built a polygenic risk score called PRState that successfully predicted prostate cancer risk in African American men. We were able to boost performance in predicting prostate cancer risk when we combined this with existing genetic risk score models, and found specifically in the Million Veteran Program, where we validated our PRState score, that it could also predict metastatic prostate cancer risk in African American men. I hope you enjoyed listening to our study, and if you have any questions, please feel free to email me. Thank you.